So there's a number of organs in your abdominal cavity that need blood flow. And to get their blood flow, there's branches and arteries off the aorta. Some of these arteries are very large that then branch again and again to supply all these organs. So what we're going to do is just kind of travel down the abdominal aorta and look at arteries that come off. A couple of these we're going to look a little closer at because they are fairly large arteries that have a lot of branches to them. But again, I want you to focus in on the terms and the words, and they should make quite a bit of sense. The first arteries off that abdominal aorta are those inferior phrenic arteries. So like the superior phrenics, these supply blood to the diaphragm. And that diaphragm is kind of the ceiling of your abdominal cavity, so they must be pretty high up on that abdominal aorta. The next one is a big one. It's a trunk. And whenever you see that word trunk, you know that there's going to be some branches. This one's known as the celiac trunk. And celiac actually means your abdomen. And this trunk has a number of branches that supply blood flow to a number of organs in your abdomen. They include the stomach, they include the pancreas, they include the liver, they include parts of the small intestine. So this trunk supplies a number of organs. The three major branches off the celiac trunk are your splenic artery, which you can imagine goes to the spleen. And if you recall, your spleen is going to be located in this upper left quadrant here. So this branch here must be that splenic artery going to the spleen. There's a left gastric, which goes to your stomach, and that branch is most likely this guy right here, all right, going to the stomach. And then there's an artery called the common hepatic, which is going to your liver, which is mostly over here in the upper right quadrant. So that would be this little, or not little, it's actually a pretty big artery, going over to the liver. So since this drawing doesn't have those organs drawn in there, you might just want to remind yourself where the spleen is, where the stomach is, and where the liver is. We're going to look at a better picture coming up. So that's a pretty big artery and branches off of it. There's another one called the superior mesenteric. That's a very large artery with many, many branches. And mesenteric, meso means middle, and teric means pertaining to the intestines. So this one tells you that it goes to a lot of the intestines. For example, most parts of the small intestine get blood from this artery. So the three regions of your small intestine include the duodenum, jejunum, and ileum. There's also a couple branches off of it that go to the pancreas. But when you think of superior mesenteric, think of upper parts of your GI tract, including almost all of your small intestines and even parts of your large intestines. We're going to look closer at that one as well. There's a little guy known as the suprarenal. It goes above a kidney, and if you think about what's above a kidney is an adrenal gland. Adrenal glands are often referred to as suprarenal glands. So these arteries go to your adrenals. Then there's the bigger renal arteries. Renal arteries are actually very large compared to the size of a kidney. So kidneys are less than 1% of the body mass. But kidneys get a whole bunch of blood flow, especially at rest. So kidneys can get 20-25% of your cardiac output when you're resting. And it's not because the kidneys need so much oxygen and nutrients. It's because their job is to clean that blood. So when you're at rest, you want to clean blood because you can afford to send more blood to kidneys. So kidneys have to have fairly large arteries going into them in order to be able to do this. There's some arteries off about midway down the aorta, there are the gonadal arteries, because gonads form up in the abdominal cavity, and then they will descend. So ovaries, if this was a female, we would call these gonadal arteries ovarian arteries, and those ovaries would eventually end up being down in the pelvic cavity. If they were testicular arteries, if this is a male and testes descend out into the scrotum, the testicular arteries would have to continue all the way down and enter that scrotum to reach the testes. Finally, there's one known as the inferior mesenteric. So like the superior mesenteric, the inferior mesenteric supplies a lot of blood to the intestines, mostly the descending colon, sigmoid colon, and rectum. And you'll notice, I just want to point out that inferior mesenteric angles towards the lower left. That's where your intestines end. You know, that's the end of your large intestines come down the left, sigmoid colon, and then out the rectum. So the lower parts of your GI tract are in the lower left area of the abdominal pelvic cavity. So that's the end of the abdomen, or the aorta, the abdominal aorta. When that abdominal aorta ends, it bifurcates or divides into two, and those are known as common iliac arteries. And then off of that kind of bifurcation, there's an artery called the median sacral artery, because it goes right down the middle of the sacrum towards that coccyx. The common iliacs are going to divide into internal and external iliac arteries. The internal iliac arteries stay in the pelvic cavity. So they're going to supply organs found in that pelvic cavity, which would be, bladder would be found in there. Some internal reproductive organs would be getting blood flow, like a uterus from that internal iliac. So those would be pelvic organs. There would also be some muscles that get blood flow from that internal iliac. The external iliac is going to start to head towards a leg. And there are arteries off of that external iliac, but it eventually becomes the major artery in the upper thigh, or the thigh area, which is known as the femoral artery. So by blood flow, you would go aorta, common iliacs, either internal or external. And if you go external iliac, you would eventually go into the leg and form the femoral artery. Looking at the celiac trunk, we can better understand it by looking at this picture. Now, can be a slightly confusing picture because the stomach has been lifted. It's been turned upward. But if you do that, you can find the celiac trunk behind that stomach. And the three branches are the left gastric, splenic, and common hepatic. And the nice thing about this picture, at least now you see a spleen, at least now you see a stomach. You still don't see a liver, but it would be over on this right side, so this would be that common hepatic going over towards the liver. And so those are the three branches off the celiac trunk. You definitely want to be able to identify those three branches and the celiac trunk. You definitely want to know what organs get blood from the celiac trunk. Parts of the stomach, spleen, pancreas, liver, and duodenum, which is this part here of your small intestine. There are other branches I'm not going to hold you to, but you'll notice that there's a right gastric artery. There's a gastroduodenal artery because it goes to stomach and duodenum. So all these are named, again, fairly logically, but I'm going to hold you to the bigger ones, the celiac trunk, and then its three branches. And then you also see that superior mesenteric. Now, keep in mind, that one is not part of the celiac trunk. It's coming off of the aorta. It's coming off independently off of the aorta and supplying upper parts of your GI. So to better understand that artery, we can look at a picture like this, where you have a lot of the intestines have been severed and removed here, because this would be all full of small intestines. But you see the small intestines, you see the large intestine or the colon, and then eventually the rectum. Posterior, you see that abdominal aorta. There's a pancreas in here that they're showing. This would be the celiac trunk right here. And then there is the superior mesenteric artery. That superior mesenteric artery supplies blood to the pancreas. So there are some branches off of it going to the pancreas. The duodenum, which is the first part of your small intestine. The jejunum, which is the second or middle part of your small intestine. The ileum, which is the last part of your small intestine. But also the ascending colon gets blood flow from the superior mesenteric, and parts of the transverse colon. These are all branches from the superior mesenteric artery. Many of them are named based on where they go. Pancreatico-duodenal, because it goes to pancreas and duodenum. Jejunals go to the jejunum. Ileals go to the ileum. Ileocolic branch goes to parts of the ileum as well as the colon. Right colic heads towards the right to the colon. So all named fairly straightforward, but I'm not going to hold you to all these branches. I want you to know the superior mesenteric and what parts or what organs does it deliver blood to. Here would be the inferior mesenteric coming off way down, almost at the end of the aorta, angling to the left, because towards the left is where you would find the last portion of the GI tract, the descending colon, the sigmoid colon, and then the rectum. So that inferior mesenteric then has to branch to be able to cover all these regions. So there's the left colic, sigmoids, and a superior rectal branch. Same rules apply. Know the inferior mesenteric and know what parts of the GI tract it delivers blood to. Finally, let's look at a leg. So like an arm, we're just trying to get as far down as we can. I'm going to hold you to basically the foot. How do you get down to that foot? You're going to have to go aorta. You're going to have to go common iliac, then external iliac. You enter the leg as the femoral artery. That femoral artery will then wrap around towards the back of the knee. So notice that these two pictures are the same leg. It's the right leg. You just are looking anteriorly and then posteriorly. So that femoral artery kind of starts more in the anterior compartment, but then goes behind the knee. It's better protected behind the knee. And recall that region behind the knee is the popliteal region. So there's a popliteal artery. Then it's going to split into the tibials. The posterior tibial is going to stay in the back. The anterior tibial is going to pop through the front and run along the front of the tibia, hence the anterior tibial. So then there's an artery directly in front of the tibia and directly behind the tibia. That anterior tibial eventually goes into the foot and is called the dorsalis pedis, or dorsal artery of the foot. The top of your foot is called the dorsum. So this is the dorsal artery of the foot, and that's an artery that you can palpate, and it can be very useful as a pulse point. That posterior tibial, let's go back behind the tibia, has an artery that comes off of it, known as the fibular or peroneal artery. And then, like the hands, there's a lot of arteries in the feet. There's a bunch of arteries on the top called dorsal arteries. There's a bunch of arteries on the bottom called plantar arteries. But I'm going to want you to be able to get to the dorsalis pedis by blood flow and be able to identify up to there. Next video, we're going to rip through the veins. The veins are going to go pretty quick because many of them are named just like the arteries. There are a few exceptions that we're going to have to work on. For example, we don't have carotid veins, we have jugular veins. So there's a few differences there. There's also more veins than there are arteries. So we're going to have to cover a few of these superficial veins that we find in our arms and our legs.